All right, welcome. My name is Ryan Harold. I'm the Paramedic Program Director for the Mesa Fire and Medical Paramedic Program. Thank you guys for joining me today. We're going to talk a little bit about the field preceptor training. We're going to go through all of our the requirements and stuff like that. So about 30 to 40 minutes. The one thing I ask is at the very end, if you guys you can stay on just until I get the attendance. I can pull the attendance off here. That way you guys get credit for being here. And give me one quick second. Someone's calling me. It's probably about not being able to log in. So give me 1 second. All right, sorry about that, everybody. So, all right, as I was saying, please stay on at the end. So when I can take attendance, I just pull it off the Teams, and that way you guys can get credit for being here. So with that, let's go ahead and get started. Let me see if I can share this appropriately with you. All right, can everybody see the PowerPoint?
Yes.
Awesome. Thank you very much. All right, so we'll go ahead and get started here. Information we're going to cover today, why we do the preceptor training, some of the objectives, goals, the qualifications that you guys and girls will need to have, responsibilities of you guys and the students, some helpful tips, and then the evaluation process. We'll go over that at the end. That's kind of a big piece. That's where you guys will evaluate the students. Why we do the training, it's an accreditation standard for all programs that are accredited by CAHEP. You have to have a program training for the preceptors. This is obviously it. It builds consistency among preceptors as well. So Preceptor A and Preceptor B hopefully will be doing the same things, and it's not, all over the place as far as the training. So it establishes consistency, ensures minimum competencies exist for all preceptors and students. And if everyone's doing the same thing, students talk, right? So if everyone's doing the same thing, it's going to establish credibility with the students as well, because they'll know that you guys are all on the same page. And creates, hopefully, better feedback between the students in the program. We have some pointers in here that should be helpful for you guys. Preceptor objectives, transition from controlled clinical setting to autonomous field environment. So when they get out to you, it's going to be very controlled initially. You guys are going to be running the calls and maybe having them walk through with you. At the very end, hopefully they're going to be autonomous. Well, they need to be autonomous to be able to work in the field environment. So the transition from the team member, which they are, to the team leader through the Capstone Field Internship. And we're going to talk a little bit about the Capstone Field Internship a little later on here. And then, of course, the successful transition from paramedic student to paramedic. Preceptor goals. So continued proficiency of all paramedic skills. So you want to make sure, of course, when they get out there, they're not going to know everything. So your goal is to make sure that they are progressing, they continue that proficiency, and they're growing each day as they get out in the field with you guys. Patient assessments across age groups. They will know all the age groups that they have to hit when they're doing their patient assessments. So when you guys are out there, you'll see they have a certain number of patient assessments they have to do. They have a certain number of skills they have to do, and they have a certain number of things that like stroke, cardiac arrest, those kind of things that they have to have. They have to have a certain number of them. They'll have all that for you guys, and they'll be checking it off as you guys go. The complaints by category, and then we talked about the progression from member to team leader. Biggest piece for you guys, preceptor qualifications. Preceptor has to be a paramedic with 2 years experience and in good standing with AZDHS. I don't see any Mesa folks on here, but for Mesa folks, Mesa, they have to have 2 years on with the city of Mesa as a paramedic as well. That is not a requirement for all other agencies. That's just a Mesa specific requirement. But you do have to have been a paramedic, or you have to be a paramedic for 2 years in good standing with AZDHS. And if you're a paramedic for your agency, I'm quite certain you're in good standing with DHS. Of course, have the willingness and drive to help maintain a good attitude, help drive the students forward, those kind of things. Preceptor Objectives, act as a role model to these students. They're young, they're fresh, they don't know a lot. They're getting some good knowledge in school right now, but act as a role model for them. Have a good attitude, share your experiences with them, talk to them before and after calls if you can, those kind of things. Of course, create and foster a safe learning environment. Safety is always paramount. So when you're out on calls, don't put them in any precarious situations that might cause harm to them, you guys, or the patient. Recognize any challenges the student may have. Serve as a resource for the student. So if you see they're struggling, please help them out. If it's something that you can't figure out what's going on with them, or if they're just not getting something, let me know and let someone in the program know, and we can get help for that student. We've got a lot of resources for them. And of course, have an active interest in educating tomorrow's paramedics. We don't want somebody in here that's just like, it seems like okay thing to do. I can, have them do all my work and I don't have to at the station and I don't have to do anything. We don't want those, because that's not going to foster a good paramedic at the end of the day. So please have an active interest. If anybody's on here and you don't want to be a preceptor, let your department know and they can hopefully switch you guys out. Preceptor Responsibilities, complete the Preceptor Preparation class, which you guys are in right now. Thank you very much. Serve as a resource in the teaching and supervision of the student during the shifts. We talked about that. Share your usual workload with the students. So your drug checkoffs, equipment checkoffs, CARMS review, those kind of things. So when you guys go to your drug checkoffs in the morning, have them come with you. They are able to do the drug checkoffs with you. They cannot sign it off, but they can sit there, and it's actually really good for them because they can know all the drugs in your box, and even more so, they can know exactly where they're carried. They'll learn the concentrations that you guys carry. So when you guys are doing your drug checkoffs, they can be there with you, have them actually do it. You guys stand right there with them, of course. Do not leave them alone. Complete the mandatory paperwork. There'll be a shift sign off on FSDAP. For those of you that are newer paramedics, you'll know what FSDAP is. We'll talk about that shortly as well. And then there'll be a paper field internship evaluation after each set. And that's something that you guys will actually fill out and then send back to me. And the evaluations forms must be sent back to you guys. Once we get to what the form looks like, I'll talk a little bit more about that as well. So some good preceptor traits: be an effective communicator. Some people are very vocal, some people are not as vocal, but the biggest point for you guys and them as far as learning is be a good communicator. Let them know what they're doing well, let them know what they're struggling in, let them know what you need from them. So if you can talk to them and let them know what they need, it's going to help them tremendously. Be a leader, a problem solver, and decision maker. That's why you guys are in this position, obviously, so I don't think that's a hard one. Be knowledgeable about CARMS. Not everybody knows everything about CARMS. In fact, nobody knows everything about CARMS, right? So just know where to locate it. If they have questions and you can't answer that question about a specific algorithm or whatever it is, say, you know what, I'm not positive, but let's go look it up together. Let's go sit at the kitchen table. Let's pull up CARMS and we'll look at it together and we'll get it knocked out. Be honest with them. If you don't know something, please don't make something up. Just tell them, hey, I don't know what this is, but let's find out. If it's something you can't figure out, you'll have my contact information by the end of this. Get a hold of me and we'll get the answer for you. And that way you can get it back to the student and get them the right information. So be supportive of the student, calm and relaxed, confident, and of course, please have a good attitude. We don't want anybody with bad attitudes. Student responsibilities, of course, they're going to be arriving on time, ready to go. They need to be professional like they normally would when they're on shift as a firefighter or a transport EMT. courteous and respectful to you guys. They need to be following the CAREMS guidelines, all of your specific agency rules, and any policies and procedures that your department / city / town has. So it's very important that you guys that they follow all of those. So work under the preceptor supervision, co-signing on all ALS charts and writing in with the preceptor. So that being said, working under the preceptor supervision, you guys as preceptors, you guys have to be with them at all times. So if you get a call, it's a med 2-in-1 or something like that, and you have two patients, 50 yards apart, you can't tell them to go over and take care of one patient and do ALS assessment, ALS skills while you're dealing with the other patient. In order for them to be considered a student and be covered as far as doing their ALS skills and assessments, you have to be with them at all times. And even later on down in the program, if you're getting comfortable with them and you're like, yeah, you know what, I think you can ride in with this patient by yourself. We'll be right behind you. If you need anything, pull over and I'll jump in with you. You can't do that. You have to be with them from start to finish. So you have to be in the back of the ambulance. You have to ride in with them every single time whenever you guys ride in. They need to be actively seeking learning opportunities. We don't want somebody that just comes in there and just runs the calls, goes back to the station, sits in front of the TV, and watches TV and does nothing and does not try to further themselves as paramedic students into paramedics. So if you come across a student like that where they're just not seeking learning opportunities or they're not being proactive, please let me know right away, and that's something we can handle on our end and get them going. So. And they have the paperwork. They'll know how to do their FISDAP daily log, and they'll know how to do their preceptor evaluation, stuff like that. But we'll talk to you guys about that at the very end. So getting started with them, clarify your expectations of the student and theirs for you. So obviously they work for your department, so you probably know them, but they're going to be in a different role now than they were previously. So when they get in for that first day, let them know maybe what your routine is, right? So maybe your routine is you get in, first thing you do is you do your drug check off, then you go do your equipment check off, and then you go in and you do your station chores, or maybe you do your station chores first and then you go do that. Whatever it is, make sure that they know what your expectations are, so they're not coming in doing what they normally would do and you're like, what is this student doing? I don't even understand why they're doing this, whatever it is. So make sure that they know what your daily routine is, what your expectations are for them on calls, after calls, those kind of things. So please just make sure that they know what your expectations are. If they have any questions for you on what they need or expect, they can let you know. So let them shadow you for the first little bit to get acclimated, even around the station on what you do for your drug check off. So don't expect them to know everything right off the bat. So let them come in, shadow you for a little bit, and let them get acclimated. Provide ongoing feedback, praise and corrections. We talked about that a little bit. So ongoing feedback, real-time feedback is really huge for these students. So if they do something well, let them know they did something well, and let them know why they did that well. If they did something that was not so great, let them know. Obviously, you don't have to yell and scream at them, but let them know what they might have done wrong and let them know what they could have done better next time. Give the student increasing responsibilities as they progress. So we talked a little bit about that. So when they start out, you're not going to, have them go jump right in and do everything on a difficulty breathing when you have to put CPAP or BiPAP on somebody, right? So, let them start off slowly, maybe watch you a few times, maybe they start their interview, maybe they do some skills here and there. So there's nothing set in stone that says the student has to do this, and this in certain, time frame. This is for you guys to decide how well your student's doing and how comfortable you are with doing their skills. So they need to be progressing, of course, but it's up to you to look at them and say, you know what, I feel comfortable with you doing this, but maybe not this right now, and we'll get there at some point. And if you do come across a student that's just not progressing, even after you've talked to them and tried to coach them, and they just are not getting certain things, please let us know immediately, and we can start working on it. Please do not wait till the end of class, because at that point, it's just going to be too late. So any signs of struggle whatsoever, please let us know early. We'll get working on it. That way, by the end of the class, we can hopefully have that fixed. So let the student help set the pace of the calls at the beginning. If they don't think they're ready, don't throw them in. Of course, sometimes once you get down the road, some students are just a little bit nervous, so they need that extra push. So that's obviously up to you guys to feel them out. And of course, they're going to be slower than you guys just because they are students. What can you do to let the student know you have confidence in their abilities? We talked about the feedback piece. I cannot stress that enough. Please give them feedback. Feedback is number one. Good, bad, or indifferent. Let them know what they did well. Let them know what they didn't do so well and what they could have done better next time. Or even if it's something that you can give them real-time feedback in the middle of a call without jeopardizing patient safety or anything like that. Be like, hey, let's talk about this. Why would you just put them on a non-rebreather when this patient's struggling? Maybe we could put them on BiPAP or maybe different medication or something like that. So if it's something where you can have that real-time feedback, please do give them feedback. That's going to be the biggest piece. And of course, let them take more responsibility when you feel capable and you feel comfortable delegating that to them. As they progress, step back and let them handle the workload, especially when it gets hectic. Of course, this is going to be a little later on once you're more comfortable with them and they've had some field experience. But as you feel comfortable, let them go, let them handle the workload. Of course, you guys will still have to be there and watch them every step of the way. But as they increase, especially when you get those hectic calls, they're going to have to do it at some point. So once you feel comfortable, let them do that. Let them try to run those calls and especially those critical patients. Are there limitations to what the student can do? Yes, absolutely they are. They cannot complete any skill or assessment autonomously during the rotation. So you cannot leave them alone to do anything. They can do anything that you guys can do as long as you guys are there with them to precept them. So you have to witness all their charts, their interventions, their drug preparation, administration, everything. You guys have to be there to monitor that. And then we talked about the ride-in piece. You guys have to ride with them to the emergency department. Anytime they go, they can never ride by themselves if they're taking a patient in. They cannot be a witness for a consent form. So this includes controlled substance and high-risk refusals. So you guys will still have to sign those, and your paramedic partner will have to be the co-signer or however your agency deems, but they cannot be the witness for those. This students can draw up and they will be able to administer RSI meds, and this is department dependent, right? Dependent. Some departments do not do RSI, so if your department does not do RSI, then obviously they cannot draw up RSI meds and give them. I know Mesa, we do RSI, and Dr. Bradley is our medical director for the department as well as the paramedic program. She is all for it. She says there's not a better controlled environment for them to do it with so many people there, with your preceptor right there. So if your department, and last year, all the medical directors of the agencies that do RSI stated that it was okay, that they would allow it. So if your department does RSI, then your student can draw up and give RSI meds as long as you are there. So approved skills and procedures, anything that's listed in the scope of practice, the state of Arizona, they can do. And I actually forgot to take this line out. My apologies. It says excluding RSI meds. The beginning of last year, they couldn't, but that was rectified. So don't look at that second bullet point there. So any skills that you guys can do, they can do. Anything that's under the scope of practice of Arizona paramedics. Can students perform paramedic student skills on duty? All of the precepting is going to be done on duty, so you don't have to worry about that. But if for some reason they are not on duty, I don't think that would come up. So yes, they can. All of them are going to be on duty. So this next bullet point is kind of a big one. We ran into this last year. If a student is on a transport unit, because we do have transport EMTs that are in school, AZDHS and COAMS, who's the one that accredits us, mandates that the student must be the third person. So if for whatever reason your agency says, hey, you know what, we are short-staffed today, you're going to be on an ambulance with your student has an EMT, your student has to perform in the scope of an EMT. You cannot precept them if it's just the two of you. There has to be a third person on the ambulance. I think most agencies are going to put their transport folks on fire apparatus, either as fourth or fifth man or woman, sorry. But if you guys ever on an ambulance shift with two people, you cannot precept them and they cannot be precepted at that time. There has to be a third person, because the thought process is if you are the only paramedic, you can't do your job and precept them as well. Am I legally responsible for their actions? Yes, you are. So meaning, again, we talked about this, you cannot leave them alone to do things. So you guys are responsible for watching over them. Are they going to make mistakes? Of course they're going to make mistakes, but you're going to be there to rectify and hopefully mitigate those mistakes. So do not leave them alone. They have to be able to precept while you're watching them at all times. And for everything, every agency here uses the CAREMS guidelines. So definitely follow CAREMS guidelines. What do you do if the student makes a mistake while treating a patient? Of course, patient and provider safety are number one. So make sure the patient is safe. You guys are safe, the best of your guys' ability. After you ascertain that safety is no longer compromised, we all have different protocols from different agencies. So follow your agency protocol. Contact me and let me know if it's something big, something we need to fix with our student. I know for MESA, let's say you give a medication, a medication error. I mean, that happens. So medication error. So what we have to do is we have to write in with the patient. We have to let the receiving physician know. We have to document it in our chart, and we have to fill in what we call it a pre-hospital. You guys probably call it something different, where you send a message to the EMS division saying, hey, this happened. These are the steps that we took. We had a medication error. We wrote in with the patient. We put it in our chart. This is the patient name. This is the chart, blah, 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 all that kind of stuff. So all you guys are going to have different policies and procedures for your specific agencies. Please just make sure that you know what those are in case something like that happens. And then let me know, of course. That's my telephone number right there. That's my cell phone, text, call, whatever. What do you do if you feel like a student is not progressing? Document all concerns in FISDAP and on the evaluation form. We will get into those shortly. Notify me to discuss the issue. Like we said earlier, please do it earlier rather than later. If you talk to a student about something that they're not doing well one or two times, and then third time, it's just like, I just don't think they're getting it. Let us know early. We have a lot of good instructors in this program that will help these students. We have instructors that'll come to stations, even if it's not their own department. We've had instructors meet students at Starbucks to help them study because they weren't understanding certain things. So please, 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 if your student is struggling, let us know early so we can get on it quickly. Remember, you're the teacher and their coach. You are creating tomorrow's paramedics. They're going to be nervous and they're going to make mistakes. That's why you guys are there, right? No one is perfect, so don't expect the students to be either. Be patient with them, but at the same time, we don't want them making the same mistakes over and over again. So they're going to ask you questions you might know the answer to. Find it out together. We talked about that, looking at CAREMS together, whatever it is. And if you can't find the answer, or you don't know, get a hold of me and we'll get it for you. Quick evaluation tool. You guys always do the tailboard talks. At least I think you do. After calls, this is a great tool for you and the paramedic students. So after a call, quick tailboard talk, or on the way back to the station, ask them, hey, what do you think went well? Let them talk to you about what went well on that call. What do you think didn't go so well? Let them talk you through it, and then ask them, what can we do different next time? Let them give you those answers, and then after you hear what they have to say, come back and maybe you give them the answers of what you thought went well, because maybe they don't line up, maybe they don't match. What did go well? Maybe the student thought that they did something that was wrong and you actually didn't think it was wrong. Maybe you thought it was the right course of action. And then of course, maybe you guys can talk about what can we do different next time, that kind of thing, just to improve the call the next time. So we brought up the Capstone Internship. So the Capstone Internship is the culmination student experience in which they apply the concepts they've learned throughout the program and with you guys into real life. So in English, basically that means they have to run 30 calls at the end of their field internship, pretty much by themselves, with little to no to little interjection from you guys. So they need to be able to run 30 calls. They'll have some sheets with them They'll write down what the call was. They'll write down the patient demographics. They'll write down the chief complaint, the interventions, the medications that they did. So they have to do this 30 times before they are considered signed off by you guys. They'll have all the necessary information for you guys when it gets a little later. There's no real time to start this. It's just it's after they get their field internship hours and after you guys feel comfortable with them. Some might have it done sooner than others. Some might be pushing up to the end, but it's just a matter of how comfortable you feel with them. So from mid-June into mid-November, they're considered in their field experience, in their field experiences. So next week, they can actually start their field internships. Mid-November is when they have their final exam. Once they have their final exam with the school, they are not considered students anymore, so they cannot precept with you guys anymore. So it has to be done before mid-November. They'll have the exact date for you, obviously, when they get to you guys. But anytime between June and November, they will get their hours in and they can get those capstone. So again, here, the last 30 patient encounters will be considered team leads in their capstone field internship. And they have to be able to do that pretty much autonomously. They're encouraged to develop their own objectives and benchmarks in addition to their own individual goals. If your student's performance is unsatisfactory, don't wait to the end of the shift to evaluate them. We talked about that. Talk to them in real time on the call if you can, or the tailboard after the call on the way back to the station or whatever. All right, so we'll talk a little bit about the evaluation piece. So how do you sign off on a shift? The student will have their iPads, hopefully with them. They will enter all their calls into the FISDAP system. It's web-based, so they will open up the FISDAP piece. It'll kind of look like this, and then they'll go to the shift piece, and then you can see up here where it's the June 26th shift. And then once that area is open, they'll have that there. You're going to go to the detailed shift report. Click on detailed shift report. You see it circled there. And that's going to take you to here, and you're going to click sign off on this shift. So you'll review it quickly to make sure all the calls are accurate, just to make sure they're not putting in calls that weren't really there. You'll see the time, the date and time, or the date up there. Once you click on sign off shift, this will pop up. This is where you can pop in any, if you have any concerns, and you can make it brief or something like patient struggling with IVs, or EKG interpretation needs help. Anything that might be, just type it in there. And on the bottom right, you'll type in your first and last name, and then that box below it here, you'll be able to use your finger and sign it. So this will be done. This one is done every shift. So agencies that are on 48-hour shifts, unfortunately, to keep it consistent, you guys will have to do this after each 24-hour shift. So I apologize for that. It's just something that I could go into all the details, but it's just for consistency piece, for accreditation and stuff, we need it done that way. So this piece, please sign off after every 24-hour shift. For those of you who are on Kelly's, of course, after your shift, you just go ahead and do that. This is the secondary piece that I was talking about. This is the paper form that they will have with them. This is something that's going to have to be signed off every set. So for the 48-hour shifts, this will be just once after the 48-hour shift. For the Kellys, this will be done after your third set, or your third shift of the set. So it should be very quick, 30 seconds. You look down at it. There's a 1, 2, 3, 4. Of course, we're not going to expect your student to be above standard or even at standard at the beginning. Hopefully they're at least at standard they need to be at standard by the end of it. But you just read over this. The first time is the longest time because you're gonna see what it is. But the next time, so whenever they hand this to you, you just go down and you just X, 2, 2, 2, 2, 2, or 2, 3, 3, whatever it is. Mark those down. Last year, the students actually emailed these to me themselves. We've changed that around this year just for specific reasons, but what can happen is they can either, once you're done with this, you can have them email this to you or scan this into you, but you will have to send this to me via your email. It can't come from the students. So if you want the students to upload it and send it you, and you can literally just hit forward and send it off to me. As long as it comes from you, that's fine. They can take a picture of it, scan it, whatever they want, but just send this to me, and just know when you guys are out there, if they're not giving you these, that these have to be done after every set. So should take you maybe 30 seconds to fill it out. If you have any comments, good, bad, or indifferent, fill those out and then give them to me. But 30 seconds, just fill it out, have the student upload it to your, send it to your email. You guys forward it off to me. Easy enough. Any questions on the evaluation piece? No? Okay. Concerns, if there are any issues that need to be addressed, contact me immediately. We talked about that. If there's simple issues, IVs will respond in their plan of action so you know it's being addressed. So when you type it in the FISDAP piece, we'll put it in there working on it with student, whatever it is. And then hopefully they'll be getting better. We did have a couple of students last year that really struggled with IVs. The preceptor put it in the FISDAP piece, and we were able to rectify it, no problem. Student came in, got some extra work with IVs, and actually is doing really well right now. That is all I have. Thank you guys for participating. This is my information here, my cell phone, my email. Please write down my email in case you, or for when you send those evaluation sheets off to me. So with that, you guys have successfully completed the preceptor training. Do you guys have any questions at all for me at this time?
I don't. Thank you, Ryan. Appreciate you, sir.
Hey, no problem. Thank you. No questions. All right. That being said, please do not get off this call yet, because I'm going to stop the recording and then I'm going to get the attendance.